Thanks for staying with us. It's Healthy Tuesday, and we've been talking about how to... we'll be discussing the Edo State issue first. We've discussed that Edo is going to make it compulsory for everyone to be vaccinated, and if you are not vaccinated, you will not have access to public space, and you'll be able to attend parties or events generally because you don't have a vaccine card. We're still wondering how that would work, how easy it would be to implement, considering that manpower and all of that. But now we have another pandemic in our hands, this one killing people. NCDC has reported that over 938 people died of cholera in Nigeria. We have over 33,000 cases across 18 states as well as the FCT. So this is another pandemic, and we still have Dr. Tuyime Bamodu with us, who is a public health expert, to tell us this is a largely preventable pandemic. It's basically based on the fact that we don't have, we live in a dirty environment. We're number 2 in open defecating worldwide, which is another issue that has increased cholera in Nigeria. Doctor, are you still with us? Can you hear me? How can we...
Yeah, I can hear you.
How can we end this cholera thing? Because I believe it's something we can end. We shouldn't have anybody die of cholera.
It's a shame. It's a shame that I can tell you for the past 10 years, we'll be having an outbreak, what I call epidemic of cholera, day in, day out. And of course, it's seasonal. We can always figure out the season this cholera thing will break out. Now, cholera is a simple disease of water, sanitation, and hygiene. So if you don't have good water supply, of course, we know that Nigeria, access to potable water is seriously compromised. A lot of people are using their boreholes. If they cannot afford, bottled water or pure water, and even in some instances, people are actually drinking from the same water they are defecating their junior sources of. Now, the second thing which you rightly pointed out was the fact that open defecation. 50 million people in Nigeria overtook India about a year ago on open defecation. The waste set on the open space will go right away to affect our source of water supply. The contamination is there. 1 out of every 5 households does not have access to defecation and sanitation equipment or process. Now, the hygiene is there. Washing of hands, which we have been shouting all about, people are not talking about it. So now, day in, day out, 23 states, close to 1,000 deaths. That's what we are having now as far as cholera is concerned. Now, the education about hygiene has gone down. The focus of government is not on public health again. Everybody wants a huge hospital built, multi-story hospital that can add to their political calculations. Rather than focusing on public health, we're focusing on the wrong thing. Nigeria, this is a big shame that in 21st century, that people, as many as 1,000 are dying from things that is preventable, simple thing. Just provide water, sanitation, and hygiene. Just by providing water, you can just deal with cholera. Now, the side aspect of it is also that we're not having the requisite education. I just see the Nigeria Center for Disease Control, sitting somewhere in Abuja, creating emergency operation centers and issues document and statistics. But listen, hey, where is the information concerning cholera prevention, even at the low government, where this information should reside? Has anybody visited any household now and said that, listen, cholera is on the ground, these are the things you're supposed to do, or distribute free water guide to prevent the germs?
I wanted to talk about the water guard, because Dr. Mebamodu, when we were kids, there was this jingle on air where the government made available some of those things during cholera outbreak. How safe are they today? And are they available? Are they available so that people can help themselves?
Now, again, the water guard is a cheap case that can be used actually to prevent the infection. All we need is actually a safe education, the education of safety of water, what you need to do for your water source. Hello? Can you hear me?
Yes.
Yes. So what we now need to do exactly is for that education and provision of that water guard, because it's a cheap thing. Now, we are certain that at this time, during this epidemic, government will roll out some vaccination, against cholera, so that we can protect some people. But those actions we're not saying. All we're saying is the number of deaths, the number of states affected, and number of people infected. So it's so basic. The responsibility to prevent cholera resides both at the home level, individual level, home level, and even at the community. What we have seen is that the primary health centers and the medical officers of health in all these local governments, they're not doing enough to campaign, to educate the people and push for prevention in terms of cholera.
Doctor, when I hear hygiene, I always worry for people who live in a clustered environment. So you see those people who live in face me, I face you shanties, on top of the water, and they don't even have a good, a proper toilet, so to speak. How do you maintain hygiene in that sort of environment? And what are some of the things that they can do to help themselves in those environments?
And most of those actions that we need to take, because those are actually the nodal points, the nodal point of cholera spread. Most of those actions we need to take should actually go to those kind of slums. Those days we used to have the inspectors, sanitary inspectors, who look around and figure out how do you dispose your waste, what's the source of your water, how do you keep the water you are drinking, what's for your hand washing. If you have councillors in those areas and you have the councillor for health, what do they call them, in the local government, they should be able to work in those things and ensure that those things happen. Now, if you are in the slum, it creates a lot of challenges in terms of sanitation and health, like you rightly pointed out. But even within that slums, there are critical things you can still do to ensure that you prevent the transmission of waterborne diseases. Now, unfortunately, in those slums, their source of water supply is actually linked to either a well or an open water source. What you need to do, because if I say ask them to boil the water, that means they have to buy gas or buy firewood to boil it. That creates another problem. So it's a special thing that you take education. I remember some 3-4 years ago when there was a cholera outbreak, we had to enter a community in Ogombo, in Lagos State here, and openly demonstrate how to use that water guard and how to keep their water in a separate bucket. This is going to a water guard you put, and you cover the bucket, and you use just one cup to fetch water from that bucket if you cannot boil the water you want to drink. So there are clear-cut, simple instructions that you can give to people in order to prevent that water, to prevent them from cholera or waterborne diseases. So it's very key. We can still do something, but like in everything, we seem not to care so much about public health. I hope we thought that the pandemic of COVID and this cholera outbreak will bring a new wave of thinking and reasoning as far as public health is concerned. But alas, we're not seeing anything yet.
One more question for you, sir, before we run off.
Yes, so apart from water guard, I just wanted to, I would like for us to maybe list maybe 5 things we can tell people now. Boil your water, we have a lot of Nigerians drink the pure water, yes, from the sachet. Sometimes it's sold in traffic. What do you need to do when you find yourself in traffic and having to buy this either bottled water or sachet water? And then, sometimes, we eat the salads, the African salads on the street. So what are the things that we should avoid right now? And what are the things that we should do right now?
We have just 1 minute for that.
Let me quickly add, sir. If you see a person with symptoms of cholera, the sugar and salt, what can you do for immediately
like for first
in your
aid?
home? Yes.
Yes, quickly. Now, we have to be actually careful on what we eat and the sort of water we drink. That is the key one. We need to be careful now. So in such a way that if it's possible for you to hold your water along and drink until you come back. And then fruits, if you have to take fruits, you have to wash your fruit. Take your hygiene seriously. Wash your hands before and after eating. And whenever you go out and come back, make sure you wash your hands with soap and water. That will help you a lot. And then don't just eat indiscriminately and consume water indiscriminately. Let's stop that for now until we get over this issue. And if you have to take charge of your water at home, if you don't have a good source of water supply, put your water in a separate bucket, cover it, put a cup over it, and put some water guard inside it to kill germs. And now, I think the other question has to do with what was the question again?
First aid.
What we need to do, should we suspend cholera? What we need to do is, the simple thing is the salt, sugar solution. What does that mean? Inside about 1.5 liters of water, you put 10 tablespoons full of sugar and 1 of salt. Pour it and mix it. Boil the boiled water that is cooled down. And people drink frequently as the student comes on. And then after that, the next thing is actually seek medical help as soon as possible. There are different solutions being sold in a sachet that can be applied to those water and then given to people. But more importantly, government needs to step up education. In our community, we need to step up education so that people don't get this disease.
Thank you so much, Doctor.
Symptoms comes off between 5 hours and 2 days. We need to help ourselves. Since we're not seeing much of our government doing a lot for us.
Thank you so much, Doctor. We've been speaking with Dr. Tuyi Mebawondu, who is a public health expert, and he's been educating us on both COVID and how it is important for us to get vaccinated, as well as cholera, which is very preventable, an epidemic that has killed over 900, has infected over 33,000, which is strictly a water, hygiene, sanitation sickness. And so what we've learned so far, just so that everyone watching will take responsibility, we cannot just blame government for not informing people. For every one of you watching, call someone in the village. If you know someone in the village, call them to be more hygienic towards their water, get water guard, separate the bucket they use for drinking water and the cup they use from the one they use for any other activity, and ensure that if they suspect any form of cholera, which is diarrhea that comes with cholera, they get a salt and water solution to drink, and we can reduce the number of people that we're losing to this highly preventable disease. So that's how we can take on health. When we'll come back, we'll move into another topic. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.